but here we are. And standing with me are representatives of people who have been on the front lines every single day since the pandemic came to our city, doing a lot of hard work, sacrificing communities, calming fears, addressing a lot of myths and misinformation, but working diligently every single day to make sure that we were doing everything possible to keep our residents safe throughout this hopefully once-in-a-lifetime global pandemic. I'm joined today by CDPH Commissioner Dr. Allison Arwady, CDPH Medical Director Dr. Geraldine Luna, and Westside United Executive Director Aisha Jocko, as well as Angela Walker of Advocate Aurora, Marcus Betts at UIC, Mary Kate Daly from Lurie's, and Jenna Kelly, formerly of the CCA, but now has joined the mayor's staff because she didn't have enough fun in the private sector. We have been working diligently in this fight against COVID-19, and I think everyone understands what we have been doing over the course of these last 2 years. We have recommitted our mission to vaccinating and protecting as many residents as possible. That still continues to be part of our COVID-19 mitigation efforts. We are in a much better place right now than we have been at any other point in the pandemic, but let me be clear, the pandemic is not over. Every week we still are seeing 10 to 15 of our residents die every week because of the pandemic. Most of them unvaccinated, and many of them people of color. Around this time 2 years ago, our city was in a very different place. On March 16, 2020, we lost our first Chicagoan, an Illinoisan, to COVID-19. Her name was Patricia Friesen, a 61-year-old retired nurse from the Auburn Gresham neighborhood on the South Side. Then 3 days later, on March 19th, CDPH issued the first of many public health orders urging sick residents to stay home. And the next day, on March 20th, Governor Pritzker issued a stay-at-home order for all Illinoisans, urging residents to stay at home, avoid gathering in groups, and go out only for essential activities. These restrictions would go into effect in our city just a day later on March 21st. And this was just the start of our battle against what has been the worst public health crisis in 100 years, and the worst economic crisis in 75 years. It's been a long, challenging 2 years since COVID-19 first hit home here in Chicago. It's hard not to be caught up in the breathtaking nature of what we've been through, having our lives every day be completely upended by something that we knew little about in the early days, except that it was very contagious and very deadly. To date, we've lost 7,586 Chicagoans due to COVID-19. And think about that. That means families have been irreparably touched by the loss of loved ones as a result of their dying from this deadly virus. We may hold them in our thoughts and prayers, but we've also got to make sure that we never forget the tragedy that they will live with from the rest of their lives. On top of the number of people that we've lost to COVID, we've also lost millions in city revenue and billions in economic losses overall, as well as precious time with family and friends. And nothing can ever make up for these losses. However, we have worked incredibly hard to ensure we never have to suffer losses like this again. And today, among the many things that we're marking, we're here to acknowledge the hard work and sacrifice of so many. A core part of this effort is centering equity and inclusion at the heart of our public health strategy. This is a task that we undertook during the earliest days of the pandemic. Given our city's painful history of systemic racism, we suspected that COVID-19 would strike our Black and brown communities the hardest, and that fear was realized. When we were going over the demographic information of COVID-19 related deaths in April of 2020, our suspicions proved to be true. I remember that day, and I will probably remember for the rest of our lives, standing right here with Dr. Arwady and announcing that from the data that we were seeing, Black Chicagoans were dying at 7 times the rate of any other demographic in our city. And as rattling as that moment was, I knew that before we shared this information for the public, that we had to have some concrete solutions to give people hope that we were working to reduce this number dramatically, and that we were providing them themselves with tools that they could use to protect themselves against the deadly virus. And we, I think, got this information on a Thursday and worked over the course of that weekend to figure out what was the best approach to go forward. And I asked my team to reach out to Westside United and Aisha Jocko, the executive director. And why we reached out to Westside United is because they had been doing incredible work on the West Side to shrink life expectancy gaps, be in the community, and create that level of trust that's absolutely essential to make sure that people are getting the help and support that they need, breaking down barriers, literally going door to door. And I knew that we needed to partner with Westside United. And as a result of that partnership and that work, we created the Racial Equity Rapid Response Team, and it was stood up in a matter of days. The RERRT brought together community leaders, public health entities, city government, health institutions, and ordinary Chicagoans to help craft Chicago's equitable COVID-19 response strategies and put those strategies into action. The RERRT's work has helped to flatten the curve of COVID-19 in both Black and brown communities, which were disproportionately impacted by this virus. The work of the RERRT laid the groundwork for future opportunities to address systemic inequities in those same communities. And you've heard me say this a lot over the course of the last 2 years. The one thing that I did not want to do is have temporary Band-Aid measures to address some of the underlying challenges that we were seeing in making sure that our communities were healthy. We wanted to build permanent foundations, not temporary scaffolding. And the RERRT has done yeoman's work at making sure that that vision actually became reality. By building invaluable connections with community members, which has helped us advance our equitable vaccine strategy, one of the best in the nation. And speaking of vaccines, we recently acknowledged the 1-year anniversary of vaccines arriving in our city this past December. Vaccines have helped us make tremendous progress in our fight against COVID-19, no denying that. And just like when COVID-19 first came to our city on the first days, we also adopted an equity and inclusion-centered strategy to distribute vaccines, again, aided and supported and executed by the Racial Equity Rapid Response Team. Through initiatives like Protect Chicago and Protect Chicago Plus, we were able not only to connect Black and brown communities to vaccine information and resources, but importantly, leverage partnerships with trusted community leaders to reduce vaccine hesitancy. And that work isn't over, but we've made tremendous progress. Further, through initiatives like Protect Chicago at Home, we were able to literally meet people where they were by offering free at-home vaccination. 31,816 vaccines have been administered through Protect Chicago at Home, plus an additional 3,521 doses as part of the special homebound program that ran from March to May of 2021. We've also knocked on over 19,000 doors through the COVID-19 Vaccine Ambassadors Program and managed a total of 468,143 calls through the COVID-19 hotline that was set up in the early days of the pandemic. And ladies and gentlemen, that work has already begun to bear fruit. One indicator of our success is the fact that there is no gap in vaccination rates between Latinx and white Chicagoans, as 75% of both demographics have gotten at least one dose. And let me reflect on that for a moment. In the early days of the pandemic, we were seeing an explosion of cases in Latinx Chicago. But because of the work that was done by the RERRT, in conjunction with community leaders in heavily Latinx majority neighborhoods, we've been able to meet this milestone where Latinx Chicago is just as likely to have received the first dose of the vaccine as white Chicago. And that, ladies and gentlemen, is remarkable progress. And in fact, some of our Latinx majority neighborhoods are among the most vaccinated in our city. While we're proud of this accomplishment, we know that there's still work to be done. Equity in vaccination still remains a high priority, as communities of color have consistently had lower vaccination rates, and that's especially true of Black Chicago and particularly the Black South Side. For example, while 82% of Chicagoans aged 5 and up have had at least one dose of COVID-19 vaccine, for Black Chicagoans, that number is just 61%, almost a 20% plus gap. We cannot stop working until vaccination percentages for every demographic in our city are as close to 100% as possible. To that end, I urge unvaccinated individuals to please visit your local pharmacy, your doctor's office, your federally qualified health center, or a pop-up clinic and get this life-saving vaccine. You can call 312-746-4835 to make an appointment for at-home vaccination. And again, that number is 312-346-4835 to make an appointment. Or visit chicago.gov/COVIDvax to find a vaccine provider near you. As I mentioned earlier, we do have more work to be done. The pandemic is not over. That's why, in addition to our ongoing work to get as many people in our city vaccinated as soon as possible, we are working from the inside out to create healthier communities. And let me explain what I mean by that. For example, the Department of Health has created Health Chicago Equity Zones as an extension of our citywide racial and health equity work. The department has allocated $9.6 million in COVID relief funding from the CDC to establish these 6 zones, which are geographic areas covering the entire city. These zones are led by regional and community-based organizations that are creating stakeholder coalitions focused on creating and deploying targeted strategies to improve long-term community and individual wellness, and helping us better address disparities that were further exacerbated during the pandemic. I've said this many times. The only way to make it out of this crisis is by continuing the partnership and collaboration that has served us well for over 2 years. For the last 2 years, residents, city and community leaders, industry stakeholders, and healthcare professionals have stepped up exponentially and answered to a calling higher than themselves to protect those around them and this incredible city that we all love and call home. I'm immensely grateful to so many people that have been part of this fight. The list is too long for me to name everyone, but chief among them is Dr. Arwady. Her team at Public Health has kept us safe, has kept us healthy, has followed the science, and made sure that our North Stars are equity and inclusion in this very difficult time, scary time when we could have easily lost our way. Dr. Arwady and the team at Public Health have kept us rooted and grounded and focused on the path forward and the work that we need to do. We will never be able to pay you back or to give you even close to the things that you deserve. But I just want to say publicly again, thank you so much. We can't count the lives that have been saved over the course of these 2 years. But we know that had we not been prepared, acted swiftly, and been open to collaboration and innovation, and adjusted constantly in response to the data that we were seeing, surely more lives would have been lost. I'm also grateful to community leaders like the ones that are standing here with us today. Aisha Jacko, who partnered with us through Westside United to work with our city in a time of great need to help us navigate this crisis in the most equitable and inclusive way possible. I also want to thank our city workers who have been on the front lines, and many of whom who never shut down because they couldn't, because their job demanded them to be ready, willing, and able to do the work every single day. And many more who return to work, bravely facing the unknown in order to uphold their commitment to public service. Their sacrifices is something that we all honor, and in their own way, they've been heroes. We also have to thank our healthcare workers who've been on the front lines. One of my biggest worries at the start of the pandemic is making sure that our healthcare workers were protected, that they had what they needed to make sure that our healthcare system was going to be able to sustain what we feared was a huge amount of cases that might break our healthcare system. Luckily, that did not happen in Chicago, and we have the institutions, but importantly, those frontline workers to thank. They are heroes. We've celebrated them, and we must continue to do so. Let me also thank our businesses, especially those in the hospitality and tourism industries, who remained resilient and pivoted to new ways of operating during the early days of the pandemic. They have borne a huge burden for all of us. They were the first to be shut down, and in some instances the last to be reopened. It's not been easy for them, and we lost many of these businesses through the course of the pandemic, but we are grateful for their continued resiliency and partnership. Lastly, I want to thank our residents. You've stood at the front lines to fight this crisis as your own form of first responders. This crisis has been very difficult to navigate, I know, for each and every one of our residents. All of us had our lives upended. The things that we took for granted about being together with friends and family, the things that we took together about the expectations of what today would look like or the next day. All of that was upended during the course of this pandemic, but you stood firm. You followed the public health guidance. You made the sacrifices that were necessary, and we are a better and stronger city because of your strength and your resilience that you've exhibited every single day through this pandemic. And we thank you and commend you for that hard work and sacrifice. This has been a very difficult and lengthy journey, and one that I hope we never have to experience again as a city. But the thing that I know is that we are prepared and ready because our residents are strong, because our public health system and our leadership is strong, because our healthcare system has learned valuable lessons about collaboration and cooperation, and because we have incredible leaders all over our city that rolled up their sleeves and did what needed to be done to keep people safe, to educate them, and that work that's been done will serve us well as we take on the other challenges that we face, particularly from a public health or healthcare standpoint. At this time, I'd like to invite Dr. Arty to say a few words.
Thank you so much, Mayor. So there's obviously a lot that we could talk about. And when I was reflecting with my team on 2 years, we do talk and think a lot about the deaths in Chicago. As you heard, more than 7,500. And we know the name, we speak the name of the first death of Patricia Friesen. But when I was reflecting back with my team, at the beginning of COVID, we knew every name. The team was following up with every patient in the hospital, doing the contact tracing, seeing, would people make it as we were learning about this disease. And before Chicago realized what that would be coming, my team knew that this was likely to hit us hard. And I was reflecting back with some of the medical directors, who were on call on those early days. Normally, the medical directors take call for 2 weeks at a time, and maybe you get a few calls a day from emergency room doctors who need advice about, rabies or whatever it might be. But when COVID started, think back about this. We had to approve at the health department every single COVID test, because there was not COVID testing available. It was only available at the CDC, meaning the collection, the mailing, the sending, the days, the isolation in the hospital setting. And so we knew those individuals. And I was on the phone day after day, trying to get testing sped up. And always my team at CDPH was there. We switched to a 24-hour call because we were, nobody could get any sleep at that point. But the team has always at CDPH worked hard to try to stay a little bit ahead. Thankfully, as you know, we had done a lot of exercises. We had met with partners to talk about what if there had been a pandemic and we needed to close schools, and what would it look like to feed all of Chicago's kids. And luckily we had stocks of PPE. Did we have everything? We did not. But were we in, I would argue, the best shape in terms of stuff of any city? Yeah, I think we probably were. But what we didn't have, and I think one of the biggest lessons we've learned in these last couple of years, was the personnel, the community infrastructure, the all hands on board approach. Because when you're talking about a foodborne outbreak that may have 5 people or 20 people, we know all those names. We know all of that contact tracing. That is a traditional size that the health department works hard every day behind the scenes to protect the public's health. But once we start talking in the dozens or in the hundreds or in the thousands, it's not just about the health department, of course. Although we continue to call and follow up each individual case and family, and the team has not backed down on this. But what we saw in COVID was what it looks like for Chicago to have one goal. To say, how does everybody think of themselves as a public health worker? I'll never forget being on one of these Zoom calls with some of the many community partners and hearing somebody, young person, who worked for an organization that was not an obvious health organization. And he said, well, I'm a public health worker. And I said, you are a public health worker. And it was music to my ears, because for years we've been talking about how the work of housing, the work of economic development, the work of creating opportunities and safe spaces and green spaces in Chicago is the work of public health. And so as I look ahead, I think vaccine has been the obvious thing to measure. But at the health department, long before COVID, we were focused on life expectancy and the racial life expectancy gap, where even before COVID, Black Chicagoans lived 9 years less long than white Chicagoans. And we saw life expectancy dropping for all race and ethnicity groups in Chicago except white Chicagoans. COVID has hit us hard. We'll be sharing soon some more information looking at not just the direct effects on our life expectancy, but the indirect. The missed cancer screenings, the diabetes care that did not happen in the way it normally would have during COVID, the ways in which people lost their jobs and then lost their insurance and then lost their ability to get health care. So many people in our city with food insecurity. We thought about crowded housing differently, not just as something to follow, but as a risk factor for not being able to isolate and quarantine. We thought about essential workers in an entirely different and I think really important way that we want to carry forward. And so as I think about really what comes next, normally I present a lot of data, as you know here. But I'm only going to show actually one slide here, which is to reassure you that our entire COVID-19 response in Chicago has been driven by data, has been driven by science, has been driven by consistent risk-based metrics. And I want to thank the mayor and the entire city for letting us do that. Because in much of this country, public health leaders have been forced out. As we've continued to learn about the science of COVID, because there was so much we did not know at the beginning, and there is so much we are still learning, it has been my goal and my team's goal to be honest with you, to follow what we are seeing and what we know, to translate the scary world of COVID into risk for your lives. And so where we look at this graph over time, you look back at March with the stay-at-home order, look how low those case counts were. They weren't actually that low. That was what our testing capacity was, and we knew that. And that's when we started talking about hospital impact and pulling that into a lot of our metrics. You look at last winter's surge, when vaccine distribution began, the big moment of hope, and the mass vaccination center opening in March, our ability in May for the unvaccinated to not need to be masking, and by June of 2021 to be fully reopened. I am very proud in Chicago that since fully reopening in June of 2021, we have never, as a city, needed to close anything down. We have not pulled a permit. We have not put a capacity restriction in place. We have not said indoor dining needs to close, schools need to shut. We have been open. In August, the city did put an indoor mask requirement back in place, an individual activity that helped us stay open, that helped limit risk. And with the Omicron surge and seeing worse than at the beginning, our hospitals and healthcare system getting threatened with COVID, we put the proof of vaccination in place for certain public spaces, knowing that the risk for the unvaccinated remains high. February 28th, look at what that graph looked like. The lowest cases now that we've seen since last July. The lowest positivity we've seen since last July, and almost the lowest we've ever seen. We're back down to the lowest number of COVID hospitalizations we've seen since last summer, and the lowest number of ICU hospitalizations. Can I promise COVID is over? No. But my team is continuing to monitor every day the variants, the data, seeing what we're learning every week, focusing on the science. And I want to thank everybody in Chicago for helping us put that science into place. We are still learning. There is still concern about variants. I still remain highly worried about unvaccinated Chicagoans because we saw during the Omicron surge how differently COVID landed on folks who were unvaccinated. And so the mayor really outlined some of the focus that we'll be doing moving forward. Continuing to work on not just vaccination, but all of the reasons that underlie differing vaccination rates. Rebuilding trust or building trust in healthcare, in public health, in government. Thinking about access in new ways, creative ways, like we did with vaccine. And recognizing that until, in a long-term way, we commit to having all Chicagoans have equal opportunities, we will not reach a healthy Chicago. So I think back on the last 2 years with a lot of humility, a lot that I know now that I wish we'd known at the beginning, but a lot of pride, especially in the way Chicagoans stepped up. And I want to thank you on behalf of the Chicago Department of Public Health for letting us be part of this response, for your trust, your questions, your pushing. And know that whatever comes next, I hope you barely hear from me again on this topic. But know that if you do, or if we are having to put masks back on, or we're having to put vaccine requirements back in, that is just temporary. That is just to get us through a surge. And hopefully, it's not something we'll need again. Thank you. And with that, I'll turn it over to Dr. Luna.
Thank you, Mayor. Thank you, Dr. Arwady. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública, y esta sección es en español. Buenos días a todos. Hoy marca el segundo aniversario de la primera muerte por COVID-19 en Chicago y el brote que se afianzó aquí. Nos reunimos hoy para honrar a aquellos cuyas vidas se perdieron por el virus y para volver a comprometer a la ciudad a luchar contra la pandemia, abordando las disparidades raciales de salud acentuadas por el brote es la manera de lograr la equidad. Patricia Friesen, del vecindario Auburn Gresham en Chicago, fue la primera persona en morir en Illinois por el COVID-19 el 16 de marzo del 2020. Trágicamente, su hermana murió varios días después, y así sucesivamente han muerto más de 7.500 habitantes de Chicago por causas relacionadas al COVID-19 en los 2 años transcurridos hasta este entonces. Fue a mediados de marzo del 2020 que se implementaron importantes esfuerzos de mitigación para mantener el virus contenidos, incluidas una orden estatal de permanecer en su casa. Las vacunas que salvan elimine los de enmascaramiento y también certificación de vacunas para los interiores. La equidad de la vacunación continúa siendo el enfoque principal de la ciudad, ya que son las comunidades de color las que se han visto desproporcionalmente afectadas con este brote y aún permanecen siendo las comunidades con las tasas más bajas de vacunación. Desde el inicio de la pandemia, a lo largo de su campaña de vacunación, la ciudad ha priorizado la equidad. Seguimos llamando fuertemente a aquellos que no hayan recibido el beneficio de la vacunación que consideren vacunarse para terminar esta pandemia de una vez y por todas. El Departamento de Salud Pública continúa ofreciendo vacunaciones gratuitas en el hogar para todas las personas mayores de 5 años. Y es la primera vez en la historia de la pandemia que los latinos y los hispanos hemos alcanzado una igualdad en el número de vacunados aquí en Chicago, con 75% de protección, por lo menos han recibido una de las dosis de la vacuna. Así que felicidades, pero todavía quedan muchas comunidades que están rezagadas en la protección contra el COVID-19 con las tasas bajas en vacunación. La vacuna también está ampliamente disponible ahora en farmacias, consultorios médicos, centros de salud calificados a nivel federal, clínicas emergentes y más. Así que, por favor, para recibir más información de un centro cercano a su hogar, llame al 312-746-4835 para programar esa cita de la vacunación a su hogar o visite a chicago.gov/COVID-Vax para encontrar una vacuna cerca de su hogar. Gracias y sigámonos cuidando, Chicago. Ahora les presento a Aisha Jaco del Westside Union. Now I let the platform to Aisha Jaco from Westside Union. Thank you.
Thank you, Dr. Luna. Good morning. I am honored to serve as Executive Director of Westside United. We are a health equity collaborative serving 10 Westside communities. Our aim is rooted in decreasing the 16-year life expectancy gap between the Loop and 10 West Side communities by 50% by 2030, leveraging the resources of our founding healthcare partners, including Amita Health, Cook County Health, Lurie, Rush, Sinai Chicago, and UI Health. Our network also includes other anchor hospitals, federally qualified health centers, community leaders, various funders, and stakeholders who are committed to course-correcting the economic and health disparities exacerbated by structural racism and historical disinvestment that has presided over the West Side. At the request of Mayor Lori Lightfoot, we proudly served as the co-convener of the Racial Equity Rapid Response Team. In March 2020, we immediately answered Mayor Lightfoot's call to help create and implement strategies to address the high COVID-19 related morbidity and mortality in African American and Latinx communities. Westside United became Chicago United. Our aim was to magnify Westside United's model, which co-mingles the edifices of community leaders and residents, healthcare, and public health. We aided the city of Chicago in pursuit of a data and community-driven mitigation of COVID-19 illness and death in Black and Brown communities. In 48 hours, with an all-hands-on-deck approach, we brought together leaders from all of our Westside United hospitals, Austin Coming Together, Greater Auburn Gresham Development Community Corporation, South Shore Works, Enlace, Latinos Progresando, Northwest Center, SWAP, Advocate Aurora Health, the Civic Consulting Alliance, Slalom, University of Chicago Medicine, and UIC's School of Public Health. We raised $7.5 million for the Racial Equity Rapid Response Team, leveraging funding from all over the country, from the likes of the Oprah Winfrey Charitable Foundation, right here in Chicago through the Chicago COVID Response Fund, Rihanna's Clara Lionel Foundation, Jack Dorsey's Start Small Foundation, and in our recent vaccine equity work, we have been privileged to work alongside the Chicago Department of Public Health, alongside MacArthur Foundation, the Chicago Community Trust, Rockefeller Foundation, the American Medical Association, and Saturday Night Live's Chris Redd. I mention these names just to highlight the power of the collaborative, the power of what happens, as mentioned earlier, when we come together to work together on a united front. Some of our other highlights in this work have been providing over $155,000 in emergency rental assistance, $500,000 in emergency cash assistance, 13,000 meals, 130,000 masks, with over 8,000 households served within the first 6 months of this work. 2 years later, the momentum created at this table has extended our community's capabilities to deploy vaccinations. And as mentioned, if you look across our great city, there are 6 Healthy Chicago Equity Zones. And Westside United diligently serves as the West Regional Co-Lead, supporting 7 community organizations that, again, help plant the seeds of the Racial Equity Rapid Response Team, but also have brought together other community warriors from Breakthrough, Esperanza Health, Erie Health, Sinai Community Institute, where they have administered vaccinations and other resources across our communities. This work is a result of Mayor Lightfoot and her entire administration believing in community and working alongside community leaders to help craft a timely response in a time when the double pandemics of racism and COVID-19 upended the world as we knew it. Today, we are stronger, determined, and more united, and proud to serve the city of Chicago. Thank you.
And now we're happy to take your questions.
Thanks a lot, Mayor. We'll start off with Craig Delamore, WBBM.
Although I have an off-topic question, so are we ready for those? We've had a lot of words on topic, so.
Okay. Where
Okay.
are we? What, let's get your mic first.
Here you go, Chip.
I'm not jumping on you this time. You got it. You got it. So we're seeing the worst outbreak since Wuhan in China right now. Other parts of Asia are on an upsurge. Europe right now, there's several parts of Europe that, you know, we're seeing waves, new waves. I'm not a scientist. I've looked closely at the variants and everything, but I don't think you're taking a victory lap here. But is it too early to have masks off, lower the protections?
Look, I'm not a scientist either, so I'm going to yield the floor to the scientists. But let me just say this. Look, we watch what happens across the world every single day. And we've been watching with concern what's happening in Europe, what's happening in China. And frankly, I think one of the understated parts of the work that CDPH does is that monitoring system across the world. And maybe Dr. Arty can talk a little bit about that. I think that what people have to do, because of where we are, which is some of the best numbers that we've seen through the pandemic, is make individual choices about what they need to continue to do to protect themselves. Looking out at this room, many of you have masks on, and it's indoors, even though we lifted the indoor mask mandate. I think our world is going to be changed, and we're going to be different as a result of what we've experienced over these last 2 years. Some people are going to be comfortable, you know, walking into large crowds. Some people are not going to be comfortable walking in large crowds. Some people are going to wear masks because they're walking into a large crowd. We know that there are different comfort levels depending upon the person's age, their underlying healthcare conditions, or just their general preferences, and we've got to be able to support all of that. As Dr. already said, we're not going to hesitate, if necessary, to reimpose some kinds of mitigations if the data tells us that we need to do that. But my goal, and you heard it from Dr. already, is to never shut our city down again. But that was devastating to do that, and the resulting economic crisis that it caused. We needed to do it to save people's lives, particularly at that stage in the pandemic, because we knew so little other than it was spreading like wildfire and potentially deadly. But we've learned a tremendous amount over the course of these last 2 years, and part of it is to make sure that we're ever diligent and watching what's happening across the world, because we could see, if you think about March of 2020, and we started to see the cases first in China, and then it spread to Asia, and then it came to Europe and Africa, and then it came to our coast, San Francisco and New York, and then started to make its way inward to the Midwest and to Chicago. We are one world when it comes to public health crises, and we can never forget that.
I would just add that, for one thing, if I am going to continue doing Facebook Lives, and we're devoting all of Thursday to variants and their tracking and what we know about them and what happens here, so you can tune in at 11 if you're interested in details. But very high level, we, of course, are watching this very closely, and I will say that Omicron in particular, I think, has proven that you cannot have a zero COVID strategy. China was trying to do that, and it is just so much more infectious that they are seeing big surges and trying to navigate what to do in that setting, and needing to, I think, frankly, change some of the approach because of how infectious and contagious that is. I think in Europe, one of the things that we are seeing there, and we are watching this very closely, Germany's breaking records, well aware. It's part of the reason we have extra variant screening set up at O'Hare. It's how, there's a lot of kind of extra things that happen behind the scenes in wastewater and otherwise to help us keep an eye on, we're a global city, and making sure that we can follow that and look for appearance and prevalence of variants. But what I can say here is that we've not seen a big, scary new variant emerge. You will know if we do. Do we see new variants? Every few days we do. That is not atypical, because every time the virus spreads, it copies itself. You can get a new variant in place. I think this BA2, which is sort of a subset of Omicron, but it is quite different from BA1, is part of what may be driving the surge in some of Europe, for example. But again, where we've been looking at the science on this, it does look in some studies in the Middle East that protection against sort of the original Omicron, if you will, does seem to be quite protective against that BA2. And again, we're at a point now where 77% of all Chicagoans, all ages, have had that first vaccine. We know there are many, many more who have recovered from COVID and have at least some immunity, although likely not as long lasting. And we are just in a different place than countries that have been different in terms of the way their outbreak has responded. So I would say we are watching closely, and if you hear, I've talked a lot about the difference between just a variant versus a variant of interest, meaning a variant we're interested in, meaning a variant or a variant of concern. Omicron, Delta, those are variants of concern. They're a big deal. Or if we got a variant of high consequence, we've still never had one of those. That would be like the vaccine is not working. Major problems. We get a variant of high consequence, almost certainly we would need to put some large scale things in place. But otherwise, the reason I put that one slide up I did was it was to help highlight that we were able to lift all restrictions and we had a good summer last summer. We really did. When a new variant came and we started to see some issues, we put the masks back on. If a new variant comes, if we have issues, we would do that again, hoping we won't need to, feeling good about the short term. But all epidemiology and really all risk at the end of the day is local. It is. It's about, you don't get infected by somebody in Germany unless you're in contact and there's that spread. And so we are continuing to monitor closely what's happening. We're following flight patterns. The CDC is doing a lot of that. We get data here in Chicago that lets us know when any disease is surging anywhere in the world, how likely is it that someone will come to Chicago actually with that disease? Like, we work that into our modeling. And during COVID, we've built the capacity to do lab testing that we never had, to do variant testing that we never had, to do modeling that we've never had. And so I can't promise what the future will bring, but I do feel very confident that right now the risk is low enough that it is appropriate where people feel comfortable to not have the universal mask requirement. But we get into trouble, it's something we would think about putting back on.
Can you talk a little bit more specifics about the markers you're looking for what constitutes trouble, masks back on?
Oh, sure. So very high level, we shared, the CDC has put out this red, yellow, green by county, which we like because it includes impacts on healthcare, which is more similar to what we've been following all along here in Chicago. I think just to put a general sense of it, I think if, we got to a yellow point here in that CDC reckoning, we would probably be recommending masks indoors. And if we got to a red point, we would probably be requiring it. That's similar to what we did last summer. When we started to see things rise, we first had a recommendation for indoor requirements. And then when it really started hitting hospitals, not waiting for, major trouble, we had that requirement. So I think that's the high level that we're talking about. People are still largely following the old metrics, and that's what we've been putting front and center. But I think likely, starting in April, we're sort of following both right now, and that's the approximate plan of what we're thinking moving forward.
Amy Jacobson.
Yeah, Dr. Awardi, can I start with you first? I have one question for you. So looking back on the last 2 years, our unmasked neighboring states, they had school and sports in 2021, and in 2020 and in 2021, our kids here in Chicago lost, life experiences that they can't get back, time that they can't get back. When you look back on that, would you have done anything differently?
So, as you may recall, once we had data, because if you look at the beginning of the pandemic, schools were closed all over this country. As we saw schools start to come back in some settings, what did we do? We looked at the data on that. And what we saw was that COVID in schools with the appropriate mitigations in place were not driving COVID in communities. It was going the other way. That's different than what we've seen in influenza and other things, by the way. And so you may recall that we were quite strong advocates, really, at the health department for moving to in-person education. And we did a comparison between kids who were in school in person earlier in last school year, like in our parochial schools, as compared to the public schools, and we didn't see a higher risk of COVID. And so when we had data on that, that's where we have been supporting and continuing to support CPS in particular in being open and staying open. And I feel very strongly about continuing in-person education. And I think some of the extracurriculars, it depends a little bit on how high the risk is at different points. But we also think, especially where kids have been vaccinated and, you know, things that there's good opportunities there. You know, want to limit, always, we want to limit things as little as we can without putting unnecessary risk in place.
And Mayor Lightfoot, you commended a few minutes ago the people, the essential workers who never stopped working 2 years ago. You know, nurses and also firefighters, EMT, police officers are a part of that. And since the positivity rate is under 1%, many see your vaccine mandate is about power and control rather than health and safety. So who specifically created this policy and under what lawful authority?
Are you talking about the
vaccine mandate?
The vaccine mandate
Yep.
for city employees? We created it in conjunction with our public health experts and following a variety of different studies that we know that having a fully vaccinated workplace creates a safe workplace. Every court that's looked at this, every arbitrator that's looked at this has upheld our authority to do that as the employer. And for me, we heard a lot from unions at the beginning of the pandemic about how their workers were afraid to come to work, that they were fearful of getting sick with the vaccine. And of course, this is long before I said vaccine, I meant virus, getting sick with the virus. And this was long before there was a vaccine that was available. There's a vaccine available. We know that it's safe. We know that it helps protect against the most serious of health outcomes. That's the way that we maximize safety within the workplace. And I stand by the decision. It's the right decision. And as a matter of fact, in excess of 80%, and depending on the department, in excess of 90% of our city employees are vaccinated.
All right, any more on-topic questions? Heather Sharon, WTTW.
Hi, Dr. Arwady, this one's for you. The CDC wastewater studies show that there's a growing amount of COVID detected in the wastewater in major metropolitan cities, including Chicago, Cook County. Are you concerned that that heralds a new surge of COVID-19 cases here in Chicago?
So, do watch on Thursday when we talk in details about wastewater and surveillance there. I think, you know, wastewater surveillance is still largely in its, not infancy, but it's toddlerhood perhaps. And I think particularly where you're thinking about quantitative levels, not just are you seeing it, but what level are you seeing it and how does that match? There's still a lot of lessons that we're learning. I will say that we do anticipate, as people are dropping masks and feeling very comfortable from a COVID perspective, that we may see some increase. I would be surprised if we did not, frankly. But the reason we wait to lift those requirements is we wait until, from an epidemiologic perspective, you are at a point where the risk is very low overall. And so you don't, you know, the whole point is to not do that at a moment where you risk really setting off a large surge again. And so, do we know that masks help limit spread? We do. Do I encourage people who are higher risk, you know, to continue wearing it for now? We do. But when people are out and about generally, we do not need to have those population level requirements in place at this time. And if we see what we've seen even in our Chicago data is anything in wastewater, and again, this is in its infancy, it only predates what we see in the case data by a couple of days. So we're watching closely. I'm frankly have been pleased to see numbers continue to decline day after day. We may hit even our lowest positivity. I told you before we lifted it, I wasn't sure we'd see under 200 cases again, because we are testing 3 to 4 times what we were testing last July when we last saw that number. So we really are in a good place right now, and I believe strongly that when we are in a good place, we communicate that and we act on that. Just like if we get into trouble, we communicate that, and if necessary, we act on that. I don't think it's realistic to have masks on until the end of time, and I do think it's important that if we do need to ask people to put masks back on again, it is based on risk here in Chicago.
And another follow-up for you. With the failure of the federal funding for COVID-19 testing and monoclonal antibodies, what city programs will the city no longer be able to offer because when that funding expires?
So there's still, I've been in a number of conversations with folks at the federal level, of course, over the last week or two. I think, my understanding is the plan is to still work to get a COVID package through, but it just was not done as part of the, the larger appropriation. There is nothing that we will be stopping in Chicago in the short term. There is nothing that we do not have money for, funding for, et cetera. Really, that funding was additional funding to allow expansion, to allow more production of vaccines within the U.S., more production of the treatments that we need and are increasingly going to be our belt and suspenders. It's part of why we want to make sure everybody's connected to care. So if they are diagnosed with COVID, we can get them those treatments that help keep them out of the hospital. But for me, the question is not about what's going to happen with that funding. It's about what are we going to do with funding public health more long term, because I will tell you, virtually all of the funding that has been allocated has had COVID attached to it. And my worry is that, Chicago, like health departments around the country, had seen a major contraction of funding and staff and capacity prior to the outbreak. And if we do not commit in this country to funding baseline public health, the chronic disease work, which drives the biggest gap, the HIV, the opioid overdose, the mental health work, and not always tie funding to COVID or Ebola or Zika, for those prior emergencies, the health department in Chicago, we had money for that for a year, 2 years, 3 years, and then it was gone. And so my bigger concern is not what happens with that funding. I'm convinced, worst case scenario, if there is a new variant, you've got to create a new vaccine. I am convinced that people would recognize the need to do some emergency funding for that. I am more concerned about whether we have learned as a country how necessary it is to build a strong and sustained public health system.
AD, quick.
Hi, Mayor. Before you ask your question, I just want to really highlight that last point. One of the very first conversations that Dr. Rarity and I had after I became mayor, and she was, I think, the acting commissioner at that time, was why is the public health budget so small? Now, this is long before COVID, and the public health budget now is substantial, but a lot of it still is dependent upon grants, and she's 100% right. At the national level, the conversation must be what will be done to make sure that our public health systems have the resources that they need to sustain themselves, not just around COVID, but the underlying healthcare conditions that really threaten life expectancy in cities like Chicago. I was on a panel back at the end of June at the U.S. Conference of Mayors with one of the top deputies at HHS and raised that specific issue with her. I know that conversation is happening, but we need that to be deepened and to have results that make sure that we can sustain the infrastructure that we built over these last 2 years, because we have great needs in public health in every major city across the country if we're going to have a healthy population. Now your question.
Thank you. I want to get your response to what we expect to hear at a press conference after this press conference from the Black Caucus about them essentially moving to take the remap to referendum. Is compromise out the window at this point?
Well, first of all, I don't know that it's the Black Caucus versus the Rules Committee, so Look, there's always an opportunity for compromise, and there's been a lot of